Nancy Jo Bush, Assistant Clinical Professor at the UCLA School of Nursing and Oncology nurse practitioner, contributing author for quite a few medical and nursing publications, including the co-editor of Psychosocial Nursing Along the Cancer Continuum. And you are the 2010 recipient of the Mara Morganson Flaherty Lectureship Award. Congratulations.
Thank you very much.
And you are also an outspoken survivor, melanoma, breast and ovarian cancer, and
Yes.
it even makes you a more special oncology nurse because you walk the walk.
I've walked the walk, and it does give you a inside perspective on all the challenges that even as an oncology nurse we don't know until we walk the walk.
Well, I think you're uniquely qualified, and it's one of the reasons, by the way, you received the Lectureship Award. Your work and research in post-traumatic stress disorder as it relates to cancer. It's not discussed enough, and it's such a profound issue for cancer patients and their family members and loved ones.
Let me tell you the example I'm using in my Mara tomorrow is it was around that 4-month period after my treatment had ended. So I had to quit my job, and I was a little bit lost on what I was going to do. And so I went back to my position I'm currently at, and I've been doing off and on since I think about 1988 in different percentages as a professor at the UCLA School of Nursing. And at that time, I had a confrontation with one of my colleagues that I love dearly, has been a friend of mine, and we were teaching a course together. And we had never had a confrontation before. And it was over a curriculum matter. And she said to me, which was stunning to me and stopped me in my tracks, she said, "You know what? You're full of anger, and you're rageful, and you're not yourself anymore, and I don't even think you're dependable anymore." And it was very hurtful for me, and I felt like I had lost this grounding, that even someone who had been such a close friend and colleague and was also a cancer survivor could not even forgive me for the stress that I was under, but that there was some change in my behavior that she was noticing that had never been in my character before. I took a leave of absence from my position, and I went off and admitted myself to a therapeutic place in Arizona to look for help for my post-traumatic stress syndrome. And I thought that you see many of these places that are advertised for everything from eating disorders to codependency issues to depression, anxiety. So I packed myself up and said goodbye to my supportive family, and I arrived at this place in Arizona, and it was one of the worst decisions I made, but one of the most insightful incisions as a professional person, because I arrived and I was strip searched, which was horrifying to me. I was there for 4 days. By the 3rd day, although very caring, I had not yet met my group support leader. I had not had an individual care plan, nor had anybody heard my story. They changed my medication. I had been on a SSRI antidepressant since diagnosis. Well, they changed that because they felt I may have bipolar because it's genetically inherited, and I have a sister with bipolar. So they changed my medication, and for the first 24 hours, I was having small, what they call extrapyramidal symptoms that feel like little seizures. And for the nighttime when I was alone, that 3rd night, I panicked and I thought, I'm going to have a seizure at this place far from home, and I'm going to die in the hands of strangers. And it was the next day that a lovely medical person, not an oncologist, a general practitioner, did my intake interview. And he listened to my story, and he looked at me and he said, "You have post-traumatic stress disorder. You're not in the right place. We don't treat PTSD. we don't treat cancer survivors. He said, we can't help you here. He put me back on my same medication and he said, you need to go home, see your own therapist, and you just need to heal. And that's when I realized there is nothing out there for our patients. I mean, we have wonderful professionals out there in the network who can be able to diagnose PTSD, anxiety, and depression. We have wonderful community resources such as yours and the wellness community, the American Cancer Society, but we have yet, for long-term survivors, been able to develop programs to deal with the mental health illnesses that are lingering in our patients over a long period of time and interfering with their personal, social, and occupational relationships.
Well, my takeaway message from you is communicate, communicate, communicate. Do not hold your feelings back. If someone looks at you and says, "Oh, you have a bad attitude," I mean, that's a real. Yeah, that's a, it's okay. We're going to have difficult days. We're going to have teary days. We're going to have sad days. That doesn't mean one has a bad attitude. It means they're just having a bad day. Cancer is stressful. The goal is not to negate the cancer survivor's experience, but to validate that experience so they can feel safer to express themselves.
Absolutely.
Your closing thought then is?
My closing thought then is right on target with yours, that all individuals who confront cancer and the challenges that this journey entails need to become self-assured in being able to express all the emotional feelings and not feel that they need to be Superman with a cape on their back and fly through, especially to please or feel that they have to please other people by showing that they're strong or a superhero, because in reality, this is a hard walk. It's a hard journey to take.